Today's lesson is breath holding spell. A breath holding spell is an episode in which the child stops breathing involuntarily and loses consciousness for a short period immediately after a frightening or emotional upsetting or after a painful experience. Breath holding spells occur in 0.1 to 5% of otherwise healthy children. They usually begin in the first year of life and peak at age 2. They disappear by age 4 in 50% of children and by age 8 in about 83% of children. Breath holding spells do not appear to be risk factors for a true epilepsy. There are two forms of breath holding spell. The first one is called cyanotic form. This form is the most common and often occurs as a part of temper tantrum or in response to a scolding or other upsetting event. Whereas the other is phallic form. This form typically follows a painful experience such as falling and banging the head, but can also follow frightening or startling event. Iron deficiency with or without anemia might be present, and some children with breath holding spells respond to iron therapy. There is no increased risk of seizure disorders in children who have had a short seizure during a breath holding spell. Medical conditions to rule out in breath holding spells include seizure, cardiac crisis, dysautonomia, cardiac arrhythmia, or CNS lesions are differential diagnoses for breath holding spell. The first key to the office management of temper tantrums and the breath holding spell is to help parents intervene before the child is highly distressed. The parent can be instructed to calmly remind the child of the expected behavior and the potential consequence of if the expected behavior does not occur. If the child does not comply, he or she should be placed in time out for a period approximately 1 minute for each of a year of age, which is called timeout. Timeout can be effectively used in children up to the age of 10 years. Parents should also be advised to be mindful of their own reaction to their children's temper tantrum to avoid an escalation of the child's behavior caused by an angry parental response. Advising parents to calmly provide simple choices will help the child to feel more in control and to develop a sense of autonomy. Providing the child with options also typically help reduce the child's feeling of anger and shame, which can later have adverse effect on social and emotional development. Providing choice also reduces power struggles between the parent and the child and can aid in enhancing the parent-child relationship and building problem-solving skills. When tantrum behavior, including breath holding, does not respond to parent coaching or is accompanied by head banging or high level of aggression, referral for a mental health or psychiatrist evaluation is indicated. Further evaluation is also recommended if tantrum behavior persists into the latency period and the preteen years. Thank you for watching. This is all about breath holding spells. Have a nice time.